HIV, or human immunodeficiency virus, is a virus that attacks and weakens the immune system within humans to the point where it stops serving its purpose of protecting the body from diseases. This disease can be spread by the exchange of infected bodily fluids among two or more people. This includes kissing with open sores on the mouth, coming into contact with an open wound or scar, using an infected needle, and having sexual intercourse with an infected person. The most common method of contagion is sexual intercourse. Once the virus enters the body, HIV cells target cells from the immune system. These cells include helper T cells, dendritic cells, and macrophages. Once HIV finds these cells, little proteins called GP120 attach to the CD4 receptor and co-receptor of the cell. This allows the HIV virus to enter the cell with ease. Then, the genetic material from the HIV cell shoots into the cell's nucleus. HIV's single-stranded RNA retrovirus then transcribes a new strand, making it a double-stranded piece of DNA, which then recombines with genetic material of the immune cell. The new genetic material overrides the cell to produce all the necessary components to create more HIV cells. These cells then burst out of the immune cell and try to infect other cells, so the cycle repeats itself. HIV is notorious for making errors when it replicates. So when the infection is mutating, it creates slightly different strains of the virus. The different strains of the virus changes which cell it's going to infect. The reason why it's so hard to catch the virus in the beginning of the infection is because it only shows flu-like symptoms within the infected person. The majority of the time, people are treated like they have the flu, allowing the virus to wreak havoc on their immune system. The immune system mounts a large counterattack, making the victim think that they are fine, when in reality, the worst is yet to come. The victim now enters the chronic stage before HIV truly damages the body. The chronic stage can last 2 to 10 years before any other signs show. This allows the number of T cells that are infected to skyrocket. Infected humans can lose around 1 to 2 billion T cells a day. Now, if the virus does not surface again for 10 years, they have lost between 4 to 8 trillion T cells. While fighting off HIV, they are also fighting off other infections. When the victim's T cell drops to critically low levels, the victim develops swollen lymph nodes and white patches on the tongue. When T cells drop even lower, AIDS, or acquired immunodeficiency syndrome, develops. People don't die directly from AIDS itself, but from any disease that attacks the body when the immune system is weak. When a person is at this stage of the disease, they are a lot more prone to develop infections and tumors. The virus is so unpredictable and mutates so spontaneously that as of today, there are no treatments available to cure HIV and AIDS, despite the decades of research dedicated to finding a cure. The best way to fight this disease is to prevent contraction in the first place. There are medications that help fight off any plausible disease a person may contract, but the risk of death is too high nonetheless. The best way to treat this disease once it's already in the body is to live a healthy and active lifestyle and to have antiretroviral therapy. This will reduce the risk of transmission. This disease is most prevalent in Africa, where about 2 million new cases of HIV are found every day. Worldwide, there are about 36.7 million people with HIV today, and more than 39 million have died since the first outbreak. This disease is not a joke. The complications are overwhelming, and the risk of death is too high. Sex accounts for 75% of the transmission of the disease. Ask your partner if they have this disease, because every person that your partner has been with, you have also been with. Better safe than sorry, so you don't have to worry. Use a rubber, kids.